Hey everyone, and welcome to today's meeting. As you join, please go ahead and select interpretation at the bottom of your screen. We are offering English and French today, so please go ahead and select your preferred language. Hi everyone, and welcome. Welcome to today's meeting. Please go ahead and select interpretation. Everyone can select either English or French at the bottom of your screen. We'll just give a minute or two for others to join us. Great, so I think we can go ahead and get started. Welcome to today's meeting. This is the third BHA WASH Emergency Partners meeting, and so really excited to see some familiar faces as well as some new names on the line. My name is Nicole Weber, and I am the WASH Technical Director for USAID BHA funded Pro WASH and Scale activity. Today, we're happy again to welcome you to engage and interact with BHA's WASH advisors, as well as share best practices and questions with other peers across the globe around water quality in emergencies. Today's meeting will be recorded and available after the event. However, we will not record the discussions in the breakout rooms. We will be taking some notes, and those will be synthesized and shared afterwards with participants as a summary document. Next slide. So today we will start with a welcome and opening words, then an introduction to today's topic and questions and answers with BHA. We will then present a brief overview of some barriers to water quality monitoring that have been identified through discussions with many of you, as well as a desk mapping. And then we'll have 2 rounds of breakout rooms. The first one, everyone will be discussing the same topic, and then the second round, some of you have weighed in on which topic you would prefer to discuss. We'll wrap up today's meeting then after a plenary readout. We'll vote on the next meeting topic and also ask for some feedback from you on today's meeting. Next slide. So I'm happy now to turn it over to Melissa, the BHA WASH team lead, for opening remarks.
Good morning, good afternoon, good evening. Thanks so much for joining us today. The WASH team is excited to be able to have an opportunity to actually speak directly with our partners again. We have been working to gather about every 6 months over the last couple of years as a way to kind of open the communication a little bit better, to hear from our partners on concerns, topics that they'd like to hear us speak more to. And water quality is one that comes up time and time again. And so very happy to have this opportunity, especially on World Toilet Day. So happy World Toilet Day to everybody. And it seemed very appropriate given the contamination that can come from poor sanitation that we're talking about water quality today. So with that, I won't delay, but I'm very happy to turn it over now to Matt Bentley. Dr. Bentley is a WASH technical advisor on the WASH team, an environmental engineer with extensive water quality experience, and very happy to have him leading our kickoff and overview of water quality. So Matt, over to you.
Thanks, Melissa, and hi everyone. Good morning and good afternoon and evening, wherever you're joining us from. If we could go to the next slide, we'll get started on an overview of water quality in emergencies, focusing on BHA's expectation and our recommendations around water quality. Next slide, please. So hopefully you all are familiar with the sphere standards for water supply. I wanted to start us here because we're talking today about water quality, but that's really only one piece of the overall kind of water supply standards that we have in emergencies. So Sphere Standard 2.1 is around access and water quantity, which is where people have equitable and affordable access to sufficient quantity of safe water to meet their drinking and domestic needs. And the Standard 2.2 is what we're focusing around today, which is water quality, which is that water is palatable and of sufficient quality for drinking and cooking, and for personal and domestic hygiene without causing a risk to health. So this really is to highlight water quality is one piece of the puzzle. It's very important for water safety, but so is access and the quantity of water provided to populations that are in emergency contexts. Next slide, please. You all are probably familiar with our water quality surveillance plan. This is part of our emergency application guidelines here at BHA. You can find this on our emergency application guidelines resources page. If you scroll down towards the end, I believe it's the second to last section is on WASH. And so we have 3 WASH annexes there, and the third, WASH Annex C, is around water quality surveillance plan. Next slide, please. So this is something that is included in most applications that feature water supply. And we have a few different columns here to provide a very quick overview of the water quality plan of a partner that's implementing a water supply intervention. So here you can see for the first column is the intervention itself. So every water supply intervention should be listed here because water quality should be measured and to ensure we're providing safe water through these water supply interventions. So we're going to list the interventions in that column. We're going to look at the critical control point for measuring water quality at different points in the system. So here you can see with water trucking, we're going to measure water quality at the tanker truck, at filling or at treatment, the distribution point once it's delivered, and at the household level. So those are various critical control points, and that will those points will depend on the type of system and the type of intervention that you're conducting. Next is the water quality parameters that are being tested, and that will depend on the water supply options and what is important to look at there, and we'll discuss that in the future slides. You list the target as well as the testing frequency. So what is our goal? What is the acceptable level of whatever that water quality parameter is, and how frequently are we testing for that? And that will depend as well. Who is responsible for actually conducting the water quality testing and ensuring that there's safe water supply to beneficiary populations? And who is that reported to when there's an exceedance or when things are not within the target ranges for different parameters? And then what are we going to do if there is an exceedance, if turbidity is too high or there's not sufficient free residual chlorine? What are the actions that the partner should take to correct those things? So these are things that you all prepare as part of your application. So we're going to be talking about some of our expectations around these in the following slides. Next, please. So a brief overview of our expectations. We require that all surface water, piped water, trucked water, and water provided to IDPs and health facilities must be chlorinated. This is true also of all water that's provided during a cholera outbreak that may be impacting the response context where an award is active. So all of these different water types must be chlorinated in order to prevent outbreaks, to promote public health. Water quality targets should also be based on national standards where those are available. Otherwise, there are international standards that can be used for these water quality targets, such as the WHO guidelines for drinking water quality. Free residual chlorine should be tested at the point of treatment, at the distribution point where populations are accessing the water, and in household stored water. This is important to ensure that we're maintaining free residual chlorine throughout the entire safe water chain, and that the water that's being consumed at the household level has sufficient levels of free residual chlorine to be safe for consumption. And WASH implementing partners are responsible for ensuring water safety during the award. Even when the government water departments are broadly responsible for chlorination and treatment, if we're funding a water supply intervention, we want the implementing partner themselves to be responsible to ensure that that populations are receiving safe water. So that's one of our expectations, is that our partners are maintaining that water quality and water safety throughout the award. Next, please. So what water quality parameters should you test for? This will depend on the source type, as well as whether it's an initial source water quality testing versus an ongoing water quality testing to monitor water quality throughout an award. So we'll start with the initial source water testing. Often these are broken into physicochemical characteristics and bacteriological. So under physical and chemical, we're looking at things like pH, turbidity, the total dissolved solids, and nitrate. You also may test for fluoride and arsenic where that's relevant. So if your geographic area is impacted by those geological contaminants, geogenic contaminants, you would test for those as well. And then bacteriologically, typically we're looking for a fecal indicator pathogen. So that would be E. coli, total coliforms, or fecal coliform. And there's various tests for those. And so selecting one that's appropriate for and available in the area where you're working is important. Next, for ongoing water quality testing, this can be broken down into chlorinated and non-chlorinated systems. These are generalizations, of course, but these are often the things that we're looking at. For chlorinated systems, we're going to be monitoring the pH and turbidity and the free residual chlorine at various steps in that water supply chain. For non-chlorinated systems, we often see pH, turbidity, and then whatever fecal indicator pathogen we're concerned about, E. coli, total coliform, or fecal coliform, depending on the test that's used. Next slide, please. So how frequently should you conduct water quality testing? This depends both on whether it's an initial source water quality testing or if it's ongoing, and what critical control point you're measuring at. So for the initial source water quality testing, we expect a water quality test before and after whatever rehabilitation works are conducted or construction. For ongoing water quality testing, this depends on the intervention and the critical control point. So water trucks, we expect water quality testing to occur at filling because the turbidity can change depending on where that water is taken from. And as you're chlorinating, you want to make sure that you're adding a sufficient chlorine dose. And so we expect water quality testing at filling for that. Chlorination points or treatment points, we expect daily testing there. For distribution points, often daily is preferred for free residual chlorine, which is quite easy and inexpensive to test. Weekly, depending on the remoteness of the system or if there are access issues, these might need to be changed a bit, but these are the ideal frequencies for testing water quality at various points. Households should also be sampled, and we recommend a random sampling at least weekly of households to ensure that we're providing sufficient free residual chlorine and that these containers are clean, and any remedial measures can be taken during the program, depending on how things are doing at the household level. For non-chlorinated systems, weekly testing is preferred, or perhaps monthly if required based on remoteness or access. Next slide, please. So how should you conduct water quality testing? For initial source water quality, we recommend sending to a certified lab whenever possible. So it's preferred to send to a certified lab rather than purchasing an expensive or complicated test kit, especially when those certified labs are available in country or are accessible. That's often preferred because it's a lot more simple to send a sample off to get tested. Those certified labs are often highly reliable and can be done very cost effectively. And complicated, expensive test kits don't often get used the way that they need to be to maintain water quality throughout an award. So this is a way to save money and time and also complexity, make things simple. Next, for ongoing water quality testing, we recommend using simple and inexpensive that are easy to train staff, wash committees, or governments to use. This would be things like pool testers for free residual chlorine, which you can see in the picture on the right here. pH strips, turbidity tubes, compartment bag tests. These are all very inexpensive and very simple techniques for measuring water quality to make sure that the water we're providing is safe. Next slide, please. So what do we do with the data? Once we've gotten our test kits, we've tested water quality, we're implementing our water quality surveillance plan with an appropriate frequency. What do we do with that data? We need to collect it first to make sure we're able to use that data within the program. But for initial source water quality testing, we are going to use that data to confirm the safety and the viability of the water source. So we're going to make sure that this is not a water source that is contaminated with some contaminant that can't be easily treated, and that it's safe for use. This also helps us to identify if an appropriate treatment method is required. I do want to mention that we don't support arsenic or fluoride treatment systems for emergency water supplies, but we instead prioritize identification or development of alternative water supplies due to the complexity and the cost of these arsenic and fluoride treatment systems. So that if that's an issue where you're working, that's one of our recommendations, is to identify sources that are safe to use first and prioritize those. So that's how we use that initial source water quality testing. For ongoing water quality testing, we can use that to adjust the chlorine dosage. So if the free residual chlorine is not reaching our targets, we want to increase the dose so that our targets are hit at each of those critical control points, including the point of treatment, the point of delivery, the distribution point, and at the household level. The household level being perhaps most important. If the free residual chlorine is dropped there, then that's an indicator that we need to do some remedial actions to ensure that that water is safe for the population. We also use this data to notify the community and the household of issues. So whoever is receiving this water should be notified if there's an exceedance or one of these parameters that's not within the expected boundaries. Next slide, please. So I wanted to keep our conversation kind of short on the front end with our expectations, so we have plenty of time for Q&A and then our breakout groups where we're going to discuss some of the barriers and opportunities around water quality. But I want to leave you with this message here at the end, which is keep it simple. Water quality doesn't have to be complicated. We don't have to use complicated and expensive test kits. We can use things that are readily available in country, very inexpensive kits to monitor at the field level that are very easy to train people with, such as this pool tester. So we recommend keeping it simple. We want to monitor water quality over the life of the award consistently and respond to any water quality needs that arise during the award. But we have an emphasis on keeping it simple because that's what's gonna happen and what's gonna be sustained through the award and ideally after the award is over. So with that, I want to open to questions. I believe Melissa is going to moderate some questions for us, and myself and some of our other WASH advisors may chime in with some of the answers to questions that you all have around our expectations around water quality or other topics. Thank you.
Thank you, Matt. You covered a lot of good territory in that, and really appreciate that. Want to give people a moment to sort of think through what they've just heard. Probably no big surprises in that. Or it might be hearing that really BHA requires chlorination, and that is a very key message in all of this. So please feel free to add your questions to the chat. I don't see any yet that are coming through, but I do know that there's several that we do get asked fairly regularly, and we'll just pose one of those now. Sorry, my chat keeps flying up and down quite a bit, so trying to keep an eye on it to make sure that there's nothing coming through. Yeah, it does not want to stay still. So please, if Nicole or Matt, you see one coming through, I'm not sure why my chat seems to fly around. But one question. Oh, yes.
Sorry, can we ask a question or we have to write? I mean, like
you're welcome to speak the question too. So please feel free to go ahead.
Okay, thank you very much. This is Manzoor from Mercy Corps, Global WASH Advisor. Wonderful, crisp presentation on the water quality. Just one question about. We know that we are talking about emergencies, and when you come to the post-emergency, especially with the community managed, let's say, systems, remote, although theoretically governments should be managing those, but practically we know that they don't reach there, etc. And in those places, managing or maintaining rather chlorination when the systems are handed over to them, when the program is still running for another maybe 6 months or so, access to chlorine compounds, proper preparation of sort of an operations of stock solutions and application, etc. Yes, we train people, we try to kind of, work through the communities, but in some cases, we may be better off kind of emphasizing on source protection rather than, sort of trying to ensure that there's a regular chlorination, which happens sometimes, but there are still risks and there are still gaps, I would say, when it comes to systems that are managed by the communities. Yeah, thank you very much.
Matt, do you want to add comments
Sure.
to that?
Yeah.
Thank you.
Thanks for your question. And it's certainly important to emphasize both chlorination during the emergency phase and also source water protection for maintaining water quality over the longer term. From our experience, implementing chlorine during an emergency phase, to your point, it may or may not be sustained after the award is over. Our preference, of course, is that that would be sustained by the community, but we know that there are challenges there. So it's important to do both, source water protection messaging as needed, but the emphasis during the emergency phase really should be on chlorination. It's simple to implement, and that's something that can be taken up again if that area is impacted by a subsequent emergency. So that is what we recommend, is to focus on chlorination. And a community may or may not choose to continue that after an award is over. Of course, our preference would be for that to continue.
And Matt, I do see some questions coming in. So the first one is, could you speak a little bit more about arsenic, your point on what we do if arsenic is found? Thank you.
Yeah. So with arsenic or fluoride, these are naturally occurring compound or chemicals that occur in groundwater in some areas of the world. They're geogenic in nature. And so our recommendation is to identify a source that does not have arsenic or fluoride above that target level wherever possible. So if you've identified a site and a particular water source has an exceedance of arsenic or fluoride, identify an alternative water supply for that population. If that can't be done, then during the emergency phase, it might be appropriate to utilize that source, notifying the community and the government of the exceedance, and understanding that that's not something we can address through an emergency award. That is a chronic risk, and so that should be something that is addressed over the long term. So that's our recommendation for arsenic or fluoride.
Thank you. And the person who asked that, feel free to come off mic if you want to ask a little bit more. Otherwise, let me keep shifting down. Here we go.
All good. Thank you.
Hello. Okay. Hello.
Yeah.
Can you hear me? Shall I proceed,
Yes.
please?
Yes. Please go ahead. Thank you.
Thank you. This is Makbub from Preserve Project in Ethiopia. So my question is, like, you mentioned it very well, like when the concentration of arsenic and fluoride is above, WHO water quality, drinking water quality parameters, then in an emergency case, you don't have option. You have to save life, and then you have to just use that source. But in the long run, like after the emergency phase, you have to look for some other options. That works for me, and we don't have option as well. But on the other hand, you also mentioned about chlorination, and now in our project we conduct water quality tests pre and post, pre-water quality test and post-water quality tests, and then the other parties on quarterly basis we conduct water qualities. We usually work with the government office. They have their own laboratories to conduct the test. But I don't think that we have to, conduct all parameters that physiological, chemical, and biological just for a source which is already identified to be suitable. But I think we will have to focus on the bacteriological taste. So for that, from your experience, if there is any recent technology, very simple, you mentioned some of them, that we can use instead of sending the sample to the government office, so that, as you mentioned, we can train wash course or community members to conduct regular water quality tests on bacteriological test. So if you have any recent technology that you recommend for us, thank you. Yeah.
Thanks for the question. I would recommend, per our expectations and requirements, that source water quality testing should occur before and after rehabilitation of any source. And that should include physicochemical characteristics. In addition, there are inexpensive techniques for bacteriological testing, but during an award, we expect the partner, the implementing partner, to be responsible for ensuring that those tests happen. So that could be compartment bag tests was one example that I used, which are very inexpensive, relatively available, and provide a quick indicator of bacteriological contamination. But certainly you all should pursue whatever is locally available for populations to continue to monitor once an award is ended, and training WASH committees on how to conduct that testing so that they can, if they can continue to monitor their own water quality. But the emphasis during the award should be that the partner is ensuring that the water provided is safe for consumption.
And I see some more great questions, so I'm going to keep us moving forward. All right. Let's see. We are facing more and more issues related to high conductivity in TDS in some specific contexts. I know there's no simple answer to this question, but any feedback from BHA on this topic?
Yeah, that's a great question. And as many of you know, groundwater total dissolved solids are increasing in many areas due to water scarcity and effects of climate change and similar issues going on. There's not really a simple answer, but I will mention that I don't believe that there's a health-related guideline for TDS from WHO, and so you should consider whether the TDS truly is high enough that it reaches a risk at an emergency level, which would be that a population would not consume that water due to taste, so that would be palatability. So they're not going to consume that water and will instead resort to unsafe sources. That would be a reason to consider an alternative water supply that doesn't have that high of a TDS. So that's typically our recommendation, is to evaluate what other water supply options exist, but in many cases the TDS might not be high enough to pose that level of risk. It might not be particularly palatable, but if we're able to communicate the importance of using this as a protected source, that can still be appropriate, rather than implementing a costly and complex treatment system, which we typically don't support in emergency settings.
So I appreciate coming back to your final message of keep it simple. We want these to be able to operate appropriately. There's another question. It says, let's see, what are BHA's expectations in terms of reporting if we have not selected to use any of the water quality indicators?
Well, you should be using water quality indicators. Every water supply intervention is required to submit a water quality surveillance plan. So that will need to be identified at the application stage, and reporting is required. So yes, so that's the simple answer.
Yep, thank you.
Could I highlight one, if that's all right?
Sure.
I just want to, there's one on here. Is there a preferred or suggested chlorination product from BHA's point of view? We don't often say, one product is sort of our go-to, but there's a suite of options available to partners, and it's the partner's responsibility to identify the most appropriate. There are some technologies, some proven technologies such as passive inline chlorination that are sort of emerging as an emergency response option. And we've seen some good success with those in some areas. And so that's something to consider in addition to batch or bulk chlorination, which is sort of the norm in emergency contexts. So um, as as is able, based on availability, consider what options you have for chlorination and what might be more appropriate. Inline chlorination, inline passive chlorination does offer a number of benefits in terms of ease of use and maintenance requirements. You don't have to have someone chlorinate every time the tank fills. Rather, as water flows through a pipe, chlorine is added at an appropriate level. So there's some technologies out there that might be worth considering, but we recommend sticking with proven technologies. So we don't want to test new things in emergency contexts that are not proven already. So those are typically the things we recommend.
And I do know that we need to keep on track on the schedule. There are a lot of other good questions in here. We have a little bit more time and we'll try to pull out just a few more, but any questions we don't get to, we will respond to after today. So don't worry if we don't quite get a chance to answer your questions at this moment. Matt, one question. When we talk about where you're going to chlorinate and household versus much more community level, can you talk a little bit about that? Why do we push towards those community level chlorination?
Absolutely. I didn't have time in my presentation, so I'm glad this question came up. We prefer centralized chlorination wherever that is possible over household chlorination. And the reason for that is that there's only one failure point with centralized chlorination. You're able to chlorinate at one location, usually by a trained operator who has been trained on how to dose that chlorine appropriately, and the entire population benefits from that chlorination. When we have to resort to household level chlorination, every household then becomes a potential failure point. If it's not implemented appropriately, if the storage container is not clean, there's all sorts of things that come up around behaviors and proper use and things like that. So it's much more advantageous wherever possible to centrally chlorinate when there is a distribution system rather than using household chlorination. But household chlorination is appropriate when centralized chlorination is not possible. So maybe that's when people are accessing water from dispersed sources, surface water sources where you can't set up a central chlorination point. That would be really the last resort would be household level chlorination.
Thank you. It was very clearly put. Okay, moving down, we have an indicator that specifies 0 fecal coliform in drinking water. Following your keep it simple advice, can daily, weekly residual chlorine levels be used as a proxy for this? And if not, what should the frequency be for doing microbiological testing?
That's a great question. I don't want to speak for our team totally, so if someone else wants to speak up, please feel free. But in most cases, you can use free residual chlorine as a proxy, because if there is sufficient levels of free residual chlorine, there should not be pathogenic contamination in that water. So if we're maintaining that FRC level, that should be providing safe water to the population. However, I would still recommend periodic bacteriological testing just to make sure that sometimes with if there's turbidity or something like that, the pathogens can be shielded from chlorine. And so in that case, we'd recommend doing bacteriological testing, but we do often see FRC used as a proxy, and that is appropriate in most cases.
And that would be in addition to the initial source water quality analysis that would be done.
Yes.
Thank you. Okay. Borehole rehabilitation is one of the easiest ways to provide access to water. In that case, what are the steps used? And you mentioned this a bit earlier about the chlorine type ways to chlorinate, but if you could reiterate, since we do see a lot of borehole rehabilitations in our work, in that case, what are the steps used to ensure water quality for borehole?
Yeah, so I think the best way to think about it is you have the initial source water quality testing and then the ongoing testing. And those parameters are going to look different, but Before rehabilitation, you should take a sample and ideally send it to a certified lab. After you've completed the rehabilitation, you do that again to make sure that we didn't contaminate that borehole during the rehabilitation process. Then you have ongoing testing, which continues throughout the award, and that would include things like residual chlorine, pH, turbidity, are kind of the most typical in that case. And for treatment options, there are a few options available to you. With borehole rehabilitation, often these are piped networks or at least feature piped systems with a storage tank. And in that case, that's a case where inline passive chlorination might be very helpful and appropriate, because you can put an inline chlorinator, which was in one of my previous slides, and that will add a little bit of chlorine as the water's passing through the pipe. Alternatively, you can do batch chlorination at the storage tank. And that would need to be done depending on the complexity of your system at potentially various storage tanks throughout the system to make sure that each distribution point has sufficient levels of residual chlorine and that it's maintained at the household level. So that's sort of the process that we would typically expect to see there.
Thank you for that. And there are still a bunch of questions, so I am going to try to just select one more and know that we will get to your questions in written form after.
I think
it'll take us a little bit.
We might be out of time for questions, unfortunately.
Okay. All right. Well, we will get back to you all. Give us a little bit of time, a few days to turn these around, but we will answer your questions.
Yeah, thanks, everyone.
Thank you, Matt. Those are excellent responses. And I'm going to turn it back over now to Nicole.
Great. Thank you, Melissa and Matt. And note, we're now moving into the breakout room part of this presentation of this meeting. And so there's a lot of opportunity to continue to discuss many of the topics that you put in the Q&A and as well as in the chat. So in order to launch the breakout room discussions, we wanted to quickly provide an update on some of the ProWash and Scale emergency drinking water quality monitoring workstream that many of you have been involved with or consulted on. So last year we started with a document review and stakeholder consultations, and this was really to identify some of the gaps, challenges, and opportunities that organizations are being faced with when it comes to water quality monitoring in emergencies. Following this, we wanted to dive deeper into some of the humanitarian responses to validate what we were hearing from these stakeholder consultations, what we were reading in the document review, to see if that matched with what was happening on the ground, and to get a better idea of where the challenges lie and what new resources or approaches might be helpful to help overcome some of those challenges. So these 5 humanitarian case studies are currently being drafted. They included 3 with the WASH clusters in South Sudan, Ukraine, Burkina Faso, and the WASH sector in Cox's Bazar and Nigeria. So one of the outputs from this first phase was a quick guide to existing resources on emergency drinking water quality monitoring and resources that could be applicable to emergency settings. Next slide. And so we just want to highlight this today. As Matt mentioned, the Sphere standards includes guidance around water quality guidelines around outbreaks and healthcare facilities. And so that's one of the resources that is in the guide. This guide also includes the WHO drinking water quality guidelines, which are more comprehensive. And so just highlighting this guide today to be a resource for you that has links to many of the resources that Matt referred to, as well as others that you might use in your work or might be interested in using. And I think my colleague will drop the link to the guide that's available in both English and French in the box. Next slide. So as we go into the first breakout room, where we will focus on discussing barriers to emergency drinking water quality monitoring and potential opportunities, we just wanted to give you a snapshot of the themes that are coming out so far from, again, the consultations that we had with some of you, the desk review, and then these case studies in 5 humanitarian responses. So these challenges can be grouped into 3 buckets. The first one is around water quality monitoring planning. So here we're seeing variations in testing frequency, selected parameters, and sample sizes. We're also seeing a lack of guidance on water quality monitoring planning, as well as standardized tools, and a focus on free chlorine residual with varied approaches to other parameters. When it comes to data and action, data is rarely standardized and compiled, and often is not being used in a timely or consistent way to inform actions and decision making. And then the third bucket, supply chain challenges are a challenge, and this is worsened by short projects and challenges with funding. So there are some opportunities that we have identified so far based on these different challenges. One might be a water quality monitoring planning toolkit with clusters and partners, looking at things that would answer many of the questions that were posed ahead of this meeting and during this meeting around what to test, where to test, frequency of testing, quality control measures, data management and tools and actions. Another opportunity that we're looking at is potentially creating water quality monitoring planning table template with examples. To support on data and action, we're considering standardized data collection tool templates, database templates, dashboard templates, as well as guidance on remedial actions and decision trees. So these are some opportunities that we have identified so far, but through the breakout room discussions, we want to spend time first giving you the opportunity to discuss with BHA, how do you feel about these list of barriers? Are there other key barriers that you or your organization face? And then what tools, resources, approaches, or organizational activities would be most impactful to address those barriers? So Tori, can you move to the slide with the breakout room instructions? Perfect. So we are going to go into that first breakout room. You'll have 20 minutes in that breakout room and be discussing these two questions. So how do you feel about this list of barriers? Are there other barriers that you or your organization face? And then what tools, resources, approaches, or organizational actions would be most impactful to address those barriers? And those can be, at your organizational level. You could have thoughts for BHA, for Cluster, for other partners working on in this space. So this will be the first discussion. You're being put into breakout rooms where you will have a BHA facilitator and you'll have a note taker from ProWash and Scale. You can write directly in the Google document. You'll be able to unmute and share, and you'll also be able to write in the chat if neither of those are accessible to you. So we hope this is a good conversation. Once you finish that first breakout room, you'll transition to a second breakout room, which will either be on corrective actions or creating an organization-wide water quality monitoring plan. So you'll kind of transition through the main room between those two breakout rooms, but we won't have a plenary readout until after the second round of breakout rooms. So I hope I hope this is an opportunity to continue the conversation that was started in the chat and the Q&A. And each of the breakout rooms has this list of barriers. It's in your note-taking document that all of you will have access to. Great. So let's go ahead. Oh, sorry,
Nicole,
go ahead.
can I just reiterate, to get to the second breakout room, you need to actually go into that second, you need to exit the first room and go into the second room.
Exactly. Yes. And everyone's being assigned, so you should automatically go from the first breakout room. You'll be sent out, and then you'll kind of see traveling through space to the main room, and then you should be sent to your second room. If you get stuck at any point in time, my colleague Tori, whose name says Tori PWS Support, can help you get to where you would like to be. I see a question. Someone would like to know what they're going to discuss in the second breakout room. For the second breakout room, you'll have those questions once you get in there, but the two topics are either creating an organization-wide water quality strategy and building internal capacity, or the second one, which is on corrective actions. I'm not going to read through the questions right now, but those will be available in that second room. Finally, to note, we have a francophone room today. So if you indicated French on your registration form, you'll be sent in a room where we have Rochelle and Precious, who will be facilitating directly in French with our ProWash and Scale note taker, Katrine. So we hope that resolves some of the interpretation challenges from last time. I think we're set. It looks like there's no more questions coming in. So I think we can go ahead and go to our breakout room story.
Okay, great. I will open those now.
Excellent. Thanks everyone for your participation on the breakout groups. If we could go to the next slide, I'll give just a brief plenary readout. While you all were meeting, I was compiling all of the responses and notes that you all have taken. There's a lot of great content in there. So I just want to pull out some of the key themes that you all have been discussing across the different groups and share some of those with you. So under the first breakout group around water quality barriers and actions, there were a number of new challenges that were highlighted. And so some of the ones that were discussed most frequently were things like supply chain issues around equipment for testing, as well as chlorine itself, chlorine availability and supply chain of water quality related materials, logistics and procurement issues, having the appropriate level of staffing to actually get water quality monitoring done appropriately. Community acceptance of chlorine was discussed quite a lot as well. We know that's a big challenge for many communities around chlorine specifically. And so that was raised in many of the breakout groups. Maintaining free residual chlorine at the household level and utilizing that data appropriately. What happens after the award ends, after the intervention ends, and will that water quality monitoring and treatment be sustained? That's a big issue. And then access issues and training of staff in the government. So lots of new issues raised and discussion around challenges. We can see pretty clearly why this is a hard thing to get done really well. But there were some great tools and actions recommended as well. So some requests for additional capacity building resources around water quality surveillance, not only specific to BHA, but also generally producing some additional materials around how to do this better. There was a focus on existing resources and tools. So many of the groups were discussing, we have a lot of tools and resources at our disposal. And so how do we utilize those better to improve our water quality strategies and monitoring plans? One of the other interesting things that came up in at least two of the groups was trying to figure out if there's a way for there to be improved coordination around water quality, whether that's a platform or some sort of tracking of water quality from partners at the cluster level. So that was something that was discussed in at least a few of the groups for potential actions and ideas. Maybe wishful thinking, but how do we better coordinate water quality surveillance and monitoring plans at sort of a country level? So moving on to the second breakout groups, we had the organizational wide water quality strategy breakout groups, and then a corrective action group. So under the organization-wide water quality strategy, there were a lot of challenges that came up. There's a lot of challenges to get water quality implemented well across an organization, particularly for international NGOs. So the recommendations that came out were to keep it simple, to focus on those really critical components, particularly chlorination, because that's one that is most important for acute risk, and also something that's relatively easy to measure. And so focusing on chlorination can simplify the plan. And it's important to allocate appropriate budget to make sure that this actually happens. Because if we don't budget for water quality surveillance, it's not going to happen. And we won't be able to collect that data. So conducting regular training and engagement came up as well. So making sure that we're regularly checking back in, continuing to promote this water quality strategy within an organization at different levels to make sure that it's getting the follow through that's needed, because it's very important to us who are kind of in the water quality realm, but the importance of maintaining that might differ at different levels within an organization. So continuing that training and engagement at a regular pace. closing the loop with corrective actions. So understanding how do we use the data and what corrective actions do we take to make sure that we're addressing these things appropriately. So that leads perfectly into the corrective action group, which focused on a number of things to improve the way that we use water quality data. But really, most of the groups discussed at the beginning, it's hard to do corrective action when we don't have good data to begin with. So we have to start with collecting good data and understanding how things are actually going so we can respond appropriately. Then we have to train staff on what to do with that data. So once we've collected it, it's got to be managed somewhere, and then how do we use it to actually implement corrective actions to improve water safety for populations. Then we also have to communicate that data both to the community and to the government, potentially depending on your context. And so there was a kind of general discussion around the need for platforms or management tools to collect, manage, message, and respond to water quality data. So that was one of the gaps that came up across a few of the different groups. So I know I've not captured all of your discussions, but there were a lot of great findings throughout all of these breakout groups. And we'll be taking some time within BHA to evaluate the discussions across the groups, come out with some ideas and some actions that we can take internally, but also things that we can share out that can help you all to improve water quality within each of your respective organizations. This is a big priority for us, as I know it is for many of you as well, to make sure that the water we're providing to communities is safe. And so thank you all very much for your participation in those breakout groups and throughout the session today. I want to pass it back over to Nicole, who has a few kind of closing questions for us. We really want to get your feedback on a few things for future topics and things like that. So thank you all for joining and for your attention.